we get going, anybody, if you want to ask any questions, just put them in the chat, and as we go along, we'll include your questions for sure, definitely. Okay, so to get started, before you do anything, you have to prepare. You have to, mentally ready, because this is a new feat and you want to understand what's going on. So the first question I'd like to extend to the panelists. Anybody who wishes to answer can answer this one, because I feel like everybody would have their own take. I'd like to ask if there are any tips to make the transition as smooth as possible, and how best we can get prepared. We're finishing third year. Okay, well, starting third year, sorry. First semester we're finishing, and going into second semester, we expect that, maybe we'll have clinicals, or in the event that, the pandemic pushes things a different way. You know what to expect because you've been there. So how do you think we can prepare for this second semester that we're going into? What should we look out for? Is there anything specific we should go and get done for preparation? Okay, let's start with Tahila.
All right, good afternoon again, everyone. So the first thing I'd like to say in response to this question is that your mindset is probably the most important thing, and that's the thing that's going to take you through clinicals. Now, with the advent of the pandemic, things have changed, and experiencing clinicals within a pandemic has been an adjustment for me, because for my entire third year, we had clinicals as usual, and in fourth year and fifth year, we've had disruptions. So first thing I'd like to say is prepare yourself to be a bit fluid with regard to your expectations, because at times you may start at the hospital and you may have to stop for a bit and continue with your online classes. So that's the first thing I would like to say. Now, in preparation for clinicals, you have to put all of your resources in one place. So unlike pre-clinicals, you don't just have to focus on your textbook alone and understanding how things happen. You now have to focus more on treatment and management and understanding how things look and how to elicit that through examinations. So I think my biggest piece of advice to you would be to get the examination videos, look for the UE style examination documents, and start looking at that from now. Because it's not like preclinicals where you can just rattle off things from a textbook. You actually have to be able to feel and see and identify things on a physical patient. So I think you need to adjust your approach from just textbook alone, and remember that you're dealing with human beings. So you have to understand the examinations as well as your rapport with patients. Now, I know a lot of people may not be great at public speaking, may not be great at interacting with their superiors and random strangers, but that's something that you have to be comfortable with now, because every day or every 3 days, you may have new patients and you need to be accustomed and comfortable with speaking to new people and speaking confidently and being able to answer questions confidently. So preparing yourself to be fluid, preparing your resources and having it in one place, learning your examinations and going into clinicals, at least having an idea about what it is, and also paying attention to rapport, being polite with your patients, and having that confidence to speak in front of people.
Whoa, definitely. That's a lot. I don't know. I feel like I had to take a really deep breath, that information, but I think it's definitely helpful. I don't know if y'all realized I was taking notes, because I feel like this is very important, and I'm so glad for this opportunity. Thank you, Tahila. That's some really great advice. I'll ask now, Owen. Can you give your take on that question, please?
Okay, so the question was about the best way to prepare?
Yes, please.
Okay, 1 second. All right, so the best way to prepare. The few things that I have to say involves having a set routine. So the first thing you need to do, you need to have a set routine. You need to be disciplined, because the thing is, and as Tahila would have said, you need to be fluid as well, because the thing is, sometimes you go on towards expecting to see a consultant and they won't show. They won't show for the whole day. You'll be waiting there for the whole day basically, and they won't show. So you have to be fluid, and you also have to have a specific routine. So in terms of the words as well, you also need comfortable shoes. So that's something very important for you guys to know, because depending on what firm or what consultants you get, you might be on wards for 6, 7, 8 hours, or however long, right? Because I've been on wards for 4 hours plus, and I have friends that have been on wards for 6 hours plus. So comfortable shoes, you need to make sure that you have the right shoes, right? And then other than that, I think Tahila would have alluded to most of the other points as well. But yeah, those are my two main points in regards to preparation and all that stuff.
All right, thank you, Owen. So when you say comfortable shoes, they still have to be, you know, business-like, so black.
Yeah.
So
they have to be yeah, business-like, but depending on what you wear. So I've seen persons wear sneakers, but the sneakers has to be black, or it isn't anything extravagant. So just try to be moderate with your decision in the shoes that you wear. So yeah, so that's in regards to the shoe.
All right, thank you, Owen. Okay, go ahead, Tahila. Yeah, man, next to your
Hi, yeah, I just wanted to add on to the point about shoes for females. Personally, I have used the Crocs. There are some covered toe shoes, and they're very comfortable, but the first week may be a bit difficult to break it in because you'll be walking up and down and standing for a long period of time. But that's my recommendation for shoes. Crocs have a professional looking shoe.
Okay, thank you. Yes, Sion, I see. Okay.
Hold on, just to add for the males as well. So I've found that, and my friends have found that the Clark shoes have been very comfortable. I've been wearing the dress Clark shoes for a period of time. I could send it later, but they've been pretty comfortable for me. So yeah.
Right, thank you, Owen. I see Sion's hand is up. Sion.
All right, guys. So in addition to what Owen and Tahila has already mentioned, is particularly Tahila's part, is history is absolutely important in third year. History and examination in particular. So Tahila mentioned examination, but as it pertains to history, it's the fundamental of third. You know, like when you first year and they said fundamentals of disease and treatment, which actually it's very important. You'll come to realize further down, if you haven't already, is that history and examination forms the foundation of your third year. If you don't have those down at the very start, or somewhere in the middle, getting it down as you should, then the rest of medical school may be a little bit difficult, because that's what you focus on a lot thereafter. You build on the principles of history and examination. It's important to try. No one will push you if you don't push yourself, to take as many histories as you can, and as many examinations as you can. If it means sweeten up your patient, begging your patient sometimes you really, really have to try. Sometimes they can be mean, depending on where you're located in terms of rotation or sites. Your patients could be different in terms of difficulty. But important, I can't stress it enough, is that you should ensure that you try to master as much as you can history and examination. And of course, that will require you to know basics, the fundamentals of first and second and part of third year, which you're probably completing right now or have already completed. So having the fundamentals of all of those years so far should be enough for you to build on. And don't be worried if you know nothing. That's absolutely fine too, because in my opinion, so far, it has repeated from fourth year. And in fifth year, the same thing does happen. It's just that you need to apply yourself to ensure that whatever is being taught now is something you can internalize, assimilate, and then be able to do it a little later on. So history and examination, that's all I have to say.
Yes, thank you. I'm loving this insight, honestly.
Yeah, I wanted to add as well, a big thing about being on the ward, starting clinicals, is actually taking initiative. Sometimes we come in having no idea what to expect. And we kind of think, oh, we're going to come, they're going to take us through everything, they're going to show us what to do. Oh, you will be over here, you will be doing that. But that's actually not quite the case. You have to be willing to ask questions. You have to go ahead and introduce yourselves and say, hey, I'm the medical student on the ward for the 2 weeks that I'm on urology or whatever, right? So a big part of it is taking initiative. You cannot wait on the doctors or the nurses to say, oh, come around, I'll show you this, or I'm going to teach you this. No. If you want to know something, go and ask. If you are interested in what they're doing, go up to them, ask them about it. You have to be interested. Like, you have to be very intentional about going on the wards. Otherwise, you go there and do absolutely nothing. Like, you'll be there just standing around doing nothing. So a big part is and you have to learn how to be vocal. Your shame tree, you have to cut down slowly but surely. The shame tree, yeah. And when you're being asked questions or when you're asked for input, because they will ask you for input, you're going to be seen as a part of the medical team. So when they ask you questions, one thing they don't want to hear is, and that's, I don't know. So I just want to stress the point that it's really important for you to try and think through things, at least try. Usually the first answer, the first thing that pops in your head is probably the right answer. And then you're probably mulling over it and thinking, oh, it's probably not, and then you talk yourself out of it. But what I found is that just say what comes to mind. It's okay if you're wrong because you are there to learn. You won't know everything and you have to get comfortable with that. You cannot and you will not know everything in medicine, right? Because there's just so much. So that's my big point to add. Taking initiative and not being initiative and not being afraid to speak up, and share what you think you know, right? So that, yeah. So I'm going to pause there.
Thank you so much. Yeah, it sounded a bit scary. I don't know if just to me, but before I'll just let Owen and Tahila give their part, but I'd like to introduce you to the second question that we have, so you can get an idea, prepare your answers. So we want to know if you could just give, a little rundown of what the structure of third year is like. So coming from preclinicals, everything is set, everybody's in the same class, you're all doing the same subjects at the same time. So going into third year, you're starting clinicals, what is the new semester like, how long is each rotation? In each rotation, is there a specific specialty that you're going to? How long is each, specialty rotation? How do you choose which hospital to go to? Do you even choose? So stuff like that. If you can give a little rundown to these last two comments, please.
Okay, I just wanted to add on Sienna's point about the initiative aspect, because so when I first went on the ward, right? So it was the first 2 days or so. I think it was the first day, right? I felt like I was thrown in the middle of the ocean with no help at all, right? So what they expect you to do is that they expect you to really take initiative. So at first, we didn't know that we could touch the dockets of the patients, right? Because nobody says, okay, go read the docket or look at the docket, or you can touch the x-ray or talk to a patient or examine a patient without anybody being there or whatever. So as Sienna said, it's very important. So you just need to know that you can, basically, they view you as a doctor right now. So they view you as, okay, you should know that you can go open a docket and go read a docket. You can know, so you can go to the x-ray room, view x-rays and all that stuff. You just need to know that you can basically do almost anything. Anything that you're not sure about, just ask. And that is a big part. And also another important point is to say that find an intern and make friends with that intern. Because you see, when you have your procedure cards to do and all that stuff, sometimes the interns, the nice interns will message you. So you give them your number or whatever, will message you and say, hey, I have this doing right now. So you want to come and do it, or you want to come and see it, or whatever the case may be, right? So you need to have initiative. And also, when you're just standing there, time will fly by fast. And basically for the whole day, you did nothing, right? So yeah, just to reiterate what Sienna said, but initiative, honestly, you control how much you learn on this clinical experience. And that's the main point that I have to say.
All right, so I'll give my comment quickly on the first question so we don't spend too much time, and then we can move on to the second. So I wanted to add to Sienna's point about shame, because I think a lot of us are accustomed to getting things correct all of the time. And then coming into a new structure for clinicals, it's difficult to hear from someone, okay, that's incorrect. And you're gonna encounter a lot of different personalities, and some doctors will be very gentle with you and others will not. That will not be some of the doctors' approach to correcting you. Some believe in tough love, some believe in being a little firm with you. So I think it's important to not take it personally and to not let it crush you, because some people feel crushed by the comments that they get, because not everyone is going to be the nicest when telling you that you're wrong. But it's important to still, work on yourself and think, okay, this is not something personal. I just need to go home, look over the concepts again, and I can be okay. I've learned something from this situation. Always remember, it's a learning experience. You're not always going to be right, but don't be afraid to be wrong, because the things that you get wrong are the things that you tend to remember years after. So if you don't mind, Shani, should I just touch on the second question?
Yes, thank you. You can go ahead. Would you like me to repeat it for those that, maybe weren't listening or can't remember what the question was?
Okay.
Sure. If you could just give us, a structure of what third year is like. How do you choose which rotation you start on? If there are certain time lengths for each specialty within a rotation, how do you choose which hospital you go to? How long are you going to spend there? Do you rotate between? Just to give those that have no idea, I definitely can say I have no idea what I'm getting into, at all. So if you can just give anyone who's confused, just like I am, any direction about what we're getting into.
Sure. So I think you mentioned 4 things within that question. So I think I'll touch on structure, and I can leave the rest for the other panelists to discuss. So with regards to the structure starting third year, now, first thing I'll say, don't expect it to be exactly how pre-COVID rotations run. The faculty is playing it by ear and things change constantly. So currently my 5th-year experience is not the pre-COVID 5th-year experience at all. And my 4th-year experience was very different, because we weren't necessarily allowed to examine patients on every rotation. But now in 5th year, it's back to pre-COVID, we're expected to examine. So with regards to the structure, I can only speak to how it was for me for 3rd year, but you should listen out for that information from the faculty. For 3rd year, you're basically going to be doing 4 rotations. If I'm recalling correctly, they were 8 weeks long. You're going to have medicine, you're going to have surgery, child health, which is pediatrics, as well as community health. So medicine is going to last for 8 weeks based on how it was structured for myself. And it's going to be split into 4. So with regards to 3rd year, they never give 3rd years the option of choosing the order of the rotations or the hospital. It's just randomized for 3rd year. In 4th year and 5th year, then there's a selection based on first come, first serve. And then you can choose your order and your hospital based on your personal preferences. So I'm going to just speak to 3rd year for now, because I think the majority of people here are 3rd years. So medicine and surgery are going to both be 8 weeks long each. And it's going to be split in half. You're going to be at one hospital for the first 4 weeks. And most likely they're going to shuffle you and you're going to be at a different hospital. So I started medicine at KPH and then I was moved to UE. When I was in surgery, I started at UE and then I was moved to Cornwall. With regards to the structure of your exams, it's no longer just a straight theory exam. You're going to have a multiple choice exam. Because of COVID, most likely that's going to be online. But back in pre-COVID times, that was something we did in person. So it's going to be a multiple choice exam, and you're going to have something called an OSCE. Now, an OSCE is the clinical aspect of the exam, and it is very important. This is where you're going to do your examinations. You're going to perform it in front of a doctor for feedback within 7 minutes. So you're definitely going to have to perfect that UE style examination and perfect it quickly, because you only have 8 weeks to practice on your patients. So take every opportunity. Every time you're assigned to a patient, don't play it the lazy way. Don't just examine them the first day and never examine them again. Try and examine them every day, so that way you are practicing your examinations. Or you can speak to your friend on another film. So let's say I'm on general medicine, but my friend is on urology. You can message your friend on urology and say, okay, do you have an interesting patient with so-and-so pathology? Or if someone is on cardio, do you have an interesting patient with a murmur? Do you have somebody with pitting edema? So that way you're not just stuck to your firm, but you can go to find patients with the pathology that you need to find that physical sign for. So if you need to learn what a dull percussion sounds like, find somebody with pneumonia, find somebody with the pathology that you're looking for. That's very, very important. So for some of the exams, it's not just going to be examination for the OSCE. You may get a tool. So for surgeries, they're big on tools. They're big on catheters. If you're doing obstetrics, they're big on clamps. So you have to learn the indications, the contraindications. How exactly do you use that tool? So that's why it's important to go to school for clinicals. It's very important to go to school, because you can't just learn these things just from a picture at home. You have to learn it from being in the operating theater and seeing the doctors using this tool for that. Or my patient has a chest tube on the ward and I see, oh, it has an underwater seal. So it's very, very important to go to school, because that's when you see things. The last aspect that you'll be graded on is an assessment from your consultant. So they're just basically going to grade your attendance, your ability to answer questions, how well you would have examined patients in their presence. So it's important to develop a good relationship with your consultant, because for some rotations, that's up to 20% of your grade, just your attendance and just how well you would have demonstrated your skills to them while on the ward. So don't miss consultant rounds. Don't miss an opportunity to speak to your consultant. If you know your patient has a right lobe pneumonia, go home and read about a right lobe pneumonia and then come and present on that. So when they come and they ask you questions after you presented your history, you would have already read up on it. So you're demonstrating your skills and you're demonstrating your knowledge. I think I'm being very long-winded. So I think that's it for the structure for now. And I'm going to pass on to the next person.
Yes, thank you, Tahila. Yes, I love your extensive answers. They're giving me the information, giving all of us the information that we really do need. Who would like to go next? I don't want to make it any, structured way. Okay, Tahila, your hand's still up. Okay, yes.
I can go then. All right. So just also to add, you're not confined to any firm at all. So I think Tahila mentioned medicine. So in terms of medicine, you're not confined to any firm. Personally, for me, I was faced on general medicine, but when my consultant didn't come to school, I would have went to another firm. So like cardiology, joined the consultant ward rounds, or would have went to nephrology, joined that consultant ward round. So really and truly, you're not confined to any firm. You can go and learn from each consultant so that you can get the best clinical experience as possible. So I mentioned surgery. So for junior surgery, so as Tahila said, in her time would have been 8 weeks. It would have been 8 weeks continuous, right? Yeah, it would have been 8 weeks continuous. But for us, due to the COVID, it would have been split up for us. So we would have done online lectures for like the first 12 weeks. So we split first 4 weeks would have been medicine, then next 4 weeks surgery, then next 4 weeks peds and aspects of family medicine, right? So that's how it would have been for us. And then we came onto the hospital for an next 12 weeks. So we would have split up those 12 weeks into 4 weeks as well. So in terms of surgery now, surgery, So the main points about surgery, the examinations, right? So mostly you'll do the abdominal examination as well as the sensory examination, right? So those are the two main examination that I did, that my consultant really focused on for us to do, because a lot of patients come in with a lot of abdominal issues for gen surgery or whatever you might have. So my advice, once you get on surgery, practice the examinations. Practice becomes perfect, right? Because at the end of your MBBS program, when you have to do MBBS, actually the MBBS exam, you actually have to do your exam in 5 minutes, right? And I'm telling you, the first time you do whatever examination you want to do, you'll take at least 10 to 15 minutes or greater than that, because you have to practice so it becomes second nature for you to just move on to the next thing, right? So abdominal examination, sensory examination, and then in terms of as Tehila said as well, what I did, so you have a specific set of patients that you see every time the consultant comes, right? So every firm has a set of patients, and every time the consultant comes to consultant wardrooms, you review those same patients until they are discharged. So what I did, I would have, the first time I went to the consultant wardrooms, I would have noted all the pathologies for each patient, and then I would have systematically went through the most common types of disorders, right? So you're going to get things like diabetic foot. You're going to get things like, well, diabetic foot is very common. Like that stench that you get on the ward, it's crazy, very common, right? You're going to get stuff like small bowel obstruction, all of those things. You're going to get things like hemothorax, pneumothorax, all those things, right? So know the common things. Common things are very common. Like when them say that, them very common, right? So for surgery, I would have went to Mandeville Regional Hospital. So I can really speak to the experience there. The experience there was amazing. I got to do everything on the procedure card because they were so interactive, and the pool, the amount of students there was small, so it didn't have to fight for procedures to be done. And we got to go into a lot of surgeries. And what I've learned from other students as well is that whenever you go to the peripheral sites, the peripheral sites meaning sites other than UE, right? Sites other than UE. Because I went to UE for my medicine rotation, and I can say that the experience at UE for practicality, for practical skills, no, nothing compares to what you experience on the peripheral sites. Because I can tell you, I went to UE at Mandeville, I was drawing blood every day. So my routine for surgery at Mandeville, went to the hospital at around 7:45, 8. Then each day I would ask the nurses, because you have to be friendly to the nurses, get acquainted with the nurses there, right? So each day I ask the nurses.
Can I just say, nurses are the backbone to medicine. So anybody that got attitude to nurses, pack it up. No, when you can't get something done, they gonna be there to help you. So lose the attitude. So no, okay, I done.
Yeah, so get acquainted with nurses. Know at least one nurse name and the schedule and all that stuff. But when I get there, every day I'd ask, do we have any new admissions, right? Because the thing is, you see, when you get there and a patient has been there for extended period of time, they usually forget the stuff that is most pertinent for you to practice your history. Because as you said, history is the most important thing at this point, history and examinations. So, and when you're doing the examinations for a person who has been there for a very extended period of time, they might not have the signs that they would have had earlier, right? So find out the new admissions. Before going on, I think somebody can answer that in the chat. I'll expand on it later. So yeah, so find new admissions and clear new admissions and all that stuff. And then you set a specific time for, you can ask the interns and say, okay, what do you have planned for today? Because every time the interns go on rounds, they have a set of plans that they have to do. So they have to draw blood, they have to send this person to get an x-ray, they have to do a lot of things. So always ask the interns what's on your plans for today, so that you can follow the interns around all day and help them to do whatever they need to do, right? So you can get to do chest tubes, all that stuff. And then for surgery, you also want to, you need to be pushy, right? So you need to ask, okay, you guys have any surgery soon? Can I join the surgery? Because when you get to see the things in real life, I'm telling you, it's pretty amazing, right? I love surgery, so yeah. But to answer Nadia's question, hope I'm pronouncing the name right. Actually, I don't think we were taught before we went on wards. Actually, I don't think so. Yeah, Sienna, yeah, we weren't taught before going on wards. It was actually on site at Mandeville that I learned to draw blood. I learned to insert an IV. Yeah, so as Tehila would have answered, yeah, you have to observe the intern or a consultant, well, the intern, right, to and see if they draw the blood or whatever. But yeah, that's my tip for surgery. But peripheral sites for most rotations is the best, right? UE, they kind of limit you in the practicality, and you really need the practicality on these rotations. So yeah.
Thank you, Owen. Before we go on, I asked Sienna to add, and Sion, if you have anything to add. I'd like to introduce my co-host, Trevon, who's also MBBS 2K24. Trevon, just if you want to say hi, you can do that. We will be asking questions, but so that we can get in as many questions as possible going forward after this one, we'll choose from our pool of questions that person submitted and direct to just one person, right? So that we can get as many questions answered as possible. So to Sienna, and unless Trevon, you want to say hi? No, man. Okay. So to Sienna and Sion.
All right. Hi. So the only thing I'll have to add to everything that was just said, two things. One, I don't know if you guys are probably scared. I probably would have been hearing all of that information. I'll probably be a little terrified, and hell, I still am currently where I am. Is that I'll just say, don't be. Just take your time, digest it, assimilate it. It's pretty easy. Once you get into it, it'll be pretty easy. Everything that has been said so far. One thing I must note is that as it pertains to examination, appreciate normal. You cannot identify abnormal if you have not examined a normal person. So if you need to examine each other, learn the examination, different techniques. So when when you've gone through the entire thing, you know how to recognize entirely what normal is, then you'll be able to recognize absolutely what pathology looks like in someone. You'll know how to feel it, you know how to elicit it. So I appreciate normal. And again, do not be terrified. Yeah.
I wanted to add something about, oh yes, and what Owen said is true. Peripheral sites, top notch, plus KPH. While I was at KPH, I got to do, it's like they don't even question whether or not you know the thing. They're like, medical student, okay, you're drawing blood today, come. I'm like, I've never done it before. Okay, but you're gonna learn how to do it now. So you're kind of thrown into doing it. And it can be scary because you're like, really, I go stick up the people them and all these things, but it's a learning process, and don't worry about it because this is where everybody started, right? Not knowing how to do it. So you're eventually going to have to just get over that initial fear of like possibly hurting the patient. It's all about the learning. It's all in the learning process. So you need practice. Patients, when you're on the wards, take that time to talk with patients. For OSCEs, as Tehila mentioned, the whole program involves a lot of history taking and examinations, right? And you have to learn how to speak up, and you have to learn how to speak confidently, no matter if you're wrong. You just have to fake it till you make it, right? So a good thing, what you could do is that sometimes when you talk to patients, a lot of them don't know why they're in the hospital and don't know what's going on with them. I say take the chance and the opportunity to say, oh, this patient has what pneumonia, okay, read up on it, come back and explain to the patient exactly what's good. Because you also have to learn how to do it in layman's terms. You can't use big words and this medical jargon when you're talking to patients, right? And the best way you know how when you've learned and understand something is when you're when you're able to transfer all that you've learned and able to translate it in a way that the average person can understand, right? And able to break it down. So I say talk to patients, talk to them as much as you can. It also helps with the history taking part of it. Just ask them questions. A lot of them actually love the company, especially in the COVID situation when you don't have a lot of visitors coming in. They want somebody to talk to, go and listen to them. Hi, morning, Miss So-and-so. What caused that bump right there, you know? And she's like, boy, you know, say, me lick up my foot, and she just go on. And then that's also learning how to build rapport with your patient, right? Because you can't be stiff and you can't be unapproachable. So it's a great way to kind of build your style and way of doing things. So yeah, so that's what I wanted to add, as well as medicine and surgery. Surgery is a little more structured where you're actually given the topics that you need to know. Medicine is a lot, right? It is quite a lot. And I don't know if you'll be able to cover everything, but as Owen said, common things are common, right? So I think what you should do, a good foundation, is to make sure you understand the basics. Like a patient with diabetes, a patient with hypertension, these are all very common things that you see on the wards, very common, right? So I think building on the common things, and then you can, move on and connect the dots, and yeah, so.
All right. Well, thank you guys so much. But I think we heard a lot more about the structure and how to get prepared. And there's a big elephant into the room now that we have to discuss. So after going on word rounds, you have your structure, you have your routine. So I'm going to ask Owen, how do you actually study after that? Where do you find the time to study when you have to be busy on the wards, traveling back home? So where and how do you find time to study if you're on wards all day?
Okay, so for me, as I said, the most important thing starting is discipline, right? So it's different for the different rotations. So for surgery, the surgeries that you view can take a very long time depending on the surgery. I've been in a surgery for over 6 hours, and then I just say, I just need to leave because I need to go home and study. So so for surgery, I would have went there 7, 8, and then I'd try to leave at around 3 or 4, right? So try and get as much as I can as possible from being there, because a lot of times some of the procedures are actually done at a later point in the day. So that's why I would have to wait until that late before I could go home. But then when I do go home though, eat dinner, rest a little bit, and then from around 8 to 12. So I study in 4-hour periods, right? So it may be different for everybody, but I study in 4 periods. So, I just use that 4 hours as best as possible. Try to reinforce things that I would have learned throughout the day, or study topics that I would have seen throughout the day, right? And then on the next day, when I go back to the hospital, I will then examine or find another patient that has the specific pathology that I studied last night. That's how you reinforce things. So remember, we said that the most important things that you have to focus on are the clinical features, right? Treatment and diagnosis, right? Those things, right? So clinical features. So you go home, you study, and then when you go back on ward the next following day, you try to ask around those specific clinical features as to what the patient might be experiencing, right? So for pneumonia, you ask them about cough, you ask them about productive cough, you ask them about shortness of breath, you ask them about a lot of those things, right? Because you want to ensure that for each topic, you ask relevant questions, because if you can't ask questions that aren't relevant, because when you're presenting your history to the consultant, which is very important, you have to add the negatives for them to understand that this is not this diagnosis. So differential diagnosis is right. So you have to add the negatives so that they know that you know what you're looking for. Because if you don't know what you're looking for and you don't know the clinical features, you won't be able to find the diagnosis, right? So that's for surgery. So left and went home and all that stuff. Then for medicine was a bit different, right? So because I was basically right beside the hospital, what I would do, I would go early. So from 7:38, right? And then I would have a very structured day. So from 8 to 1, I would have tried to, 8 to 12, actually, I would have tried to examine patients, go on ward rounds, and then at 12 o'clock, they usually have online classes, right? So they have online classes and you have to go to that online class, and then, sorry about the bike. Yeah. So you have online classes, and then what I would do after those online classes, I would probably not go back to school, right? Because at that point, as we said, medicine is very hefty. When I say medicine is very hefty, medicine is very hefty. It has a broad range of topics, right? And it can legit be tested on any and anything. So you need more time to study for medicine than per se surgery, because you'd have already had the structure for surgery. So it's easier for you to plan for surgery than for medicine, right? So yeah.
Right, thank you for that. So we're going to try to see if we can squeeze in as much of questions as possible. I notice you guys are asking in the chat and the seniors are also helping you guys. So please, if you guys have a question, ask in the chat. So we're going to switch up the, the general point here. So we heard a lot about clinical. So we heard about recommendations, we heard about the sites, and we heard about how to start preparing. But here's something that we don't normally talk about. So lots of people may have anxiety. And it's very easy. We hear the stereotypes of people being scared of consultants. So 2 questions are going to fuse into one. And I'm going to ask Sion is, how do you prevent yourself from embarrassing? How do you try not to embarrass yourself in front of consultants? And how true are the stories of students being asked to leave ward rounds or the ward for not understanding a case?
Sorry, not hearing you, Sion. Still muted.
Right, sorry, my mic was off. Hi. All right, so your first question was, how do you prevent yourself from being embarrassed, and how true those stories are? As already mentioned, they are true. Unfortunately, they are. And it depends on how well you gauge each person. So personally, and I should have mentioned from the start that everything that each of us have said so far is based on personal experiences and personal opinions, not based on anything that has worked. Because something that may work for me may not necessarily work for someone else. But based on me personally, I've learned how to gauge some consultants and learned how to approach them differently. So I have a different approach for different consultants so as to minimize or diminish per se their responses toward me. It depends, because sometimes people have their personal problems which really they should not bring to work, but nonetheless they're there. So it depends on gauging each person, their mood, honestly, especially in Jamaica here, depending on the hospital which you're located at as well. The responses could be very different, but unfortunately, I must admit, as I'm sure the other seniors would have admit also, is that sometimes you can experience that and you just have to take it sometimes. You'd oftentimes want to take it up with the administrative board or whoever else. Unfortunately, med school is not too kind. You did not hear that from me, but I've had personal experiences where I've gone the extra mile to ensure that, the disrespect, I think we're all grown here. We don't need to speak to each other as such. But for whatever reason, some residents even and consultants feel like they have the right to speak to you in a certain way. And sometimes you just have to suck it up, move on, and move out to your rotation. At the end of the day, they're the ones setting your exam. You can assume what you will from that. Your second question, I don't recall it exactly. So if you could go ahead and repeat it for me.
Right. So the second aspect of the question is, how do you really generally prevent yourself from embarrassing? Because some people may have anxieties, they might get nervous when they're tackling an issue. So how do they try to manage that? How do they try to prevent this anxiety and embarrassing themselves?
Truthfully, there's no one way, and this is probably linked to my first answer. It's depending on who you're dealing with. Unfortunately, you'll end up learning the hard way that for some people, I've been embarrassed a couple of times, if I'm being honest, and oftentimes it's because I don't speak up. And Sienna mentioned earlier that the first answer oftentimes is usually the correct answer, but sometimes you're wrong and you're strong. Them want if it's what come to your head, say it so they can correct you. But if you come and you speak and you're speaking all you're afraid to speak, and I understand the anxiety behind it. Sometimes I wonder if they forgot that they were once students and interns before they became residents and consultants. It still puzzles me and baffles me, but I don't wonder on it too much anymore. I just allow it to slide. It's just you have to learn an individualized approach to each resident and consultant before you answer questions, before approaching them with anything at all, any procedure that you need to have done, any questions that you want to ask. Some of them are pretty forthcoming. They're pretty easy to talk to. They're pretty understanding. They're very accommodating of students. So it's pretty easy to approach them. Others, not so much. The first day you meet a consultant, you gauge them all. But again, sometimes you have to be a different type of student than your norm. I can't say there's any one way that you should or something that you should do to ensure that that does not happen, because sometimes you could be doing your absolute best and it still happens. And sometimes you're not even wrong. Sometimes you right and them wrong and very strong. But who am I to go debate it with a consultant in the middle of the water and you do not have a winning battle in that very moment? So choose your battles wisely.
All right. Thank you so much for that.
No problem.
And it's really true. Sometimes you may have anxiety, guys. But I do recommend try to look at YouTube, try to find self-help resources for anxiety management, and you'll be surprised how good you can manage that on your own. So we're going to switch up the segments again because we're trying to get as much questions in, and I'm going to just try to mash up the questions together, guys. So to Sienna, what do you wish you knew before starting rotations? And what would have been your top 3 recommendations for anybody going in? Sounds like a summary question for the day, but just to figure it out, what would you wish you knew before you started clinicals? And what are your top 3 recommendations before starting clinical years?
Okay, a loaded question. So what I wish I knew, as I had mentioned before, when you're being thrown into clinicals, you have no idea what to expect. So when you're there, I didn't know that there would be no kind of structure on the words in terms of, you're being taught this a certain with this at this point, then you're being shown how to do that at this point. So yeah, so the whole initiative thing, taking the initiative thing, I didn't know that my entire clinical experience would be up to me and how I go about it, essentially. That's what I wish I knew, right? Because then it would have saved you a lot of time sitting there thinking, oh, the consultant is going to come. Yeah, so I kind of struggled with that initially. And then one day it hit, oh, okay, I need to figure this out. I need to approach the interns, the residents. I need to approach the nurses. I need to approach the consultants, because really and truly, they're working and they're in their zone, and you are there to shadow, and you're there to follow, and you are there to kind of see how it's done. So again, that's why it's up to you, because it's almost as if you're infringing sort of, kind of like, and it might feel that you're in. A lot of times I felt like I'm in the way of what they're doing, but you have to but you have to be, right? Otherwise you won't be able to grasp things, right? And again, on the words, what I wish I knew, yeah, I think the initiative thing was the base, was the real issue that I had faced initially. In terms of recommendations, I'd say always read around what's on the word, because that's what you're going to be asked. That's what you're going to be questioned on. That's what's going to come on your exam, possibly, right? What you're seeing on the words. Another thing is that, okay, you're going to be split into groups. right? And it's going to be groups of students on the wards. Another thing is to work together. It is teamwork, right? You have to be, so you want to practice with each other. You want to ask each other questions. You want to support each other on the ward. Don't leave. Well, I was in a smaller group at KPH, so I was able to kind of, so what we did kind of influenced each other's experience, I should say, right? So you have to be able to learn to communicate with the group you're in, with the group leader. You have to organize.
Annoyed.
You have to.
You can go ahead, Mansiana, don't worry.
Yeah. Okay, so you have to be able to communicate. Because can you imagine one of you, or let's say, for instance, let's say the consultant doesn't come on this particular day, right? All of you on your own decide to not show up on the wards that day, right? Resident comes in, where are the medical students, right? So you get what I'm drifting, like you have to communicate, you have to work together. Like, I don't think that there's a day where all medical students, maybe you take this day and we'll be on the wards this day, and you get what I'm saying? Teamwork, as well as practice, a lot of practice. So for me, my OSCEs, I was a lot more comfortable with my OSCEs and more confident because I was practicing every day, right? And the key thing is to have, like, find a group of people, like a study group per se. You won't be, the unfortunate thing is that you won't necessarily be with your original study group when you're being split into your different rotations, right? That's what's going to happen. So what you're going to have to do is to reach out and find people and practice. So what we did is we had one historian, one person taking the history, one person giving the history, and one person giving feedback, right? And jotting down where you fell down on, where you could have improved, right? Practice, practice, practice. Everything will come more naturally. Everything will you'll feel more confident when you know that you've done this like 100 times. You've done this over and over. You've got it, right? Especially when it comes on to exams. So that's that. So practice. So as I've said, practice, teamwork, communication, taking initiative. So those just off the top of my head, that's what I can think of. So
Sienna, okay. Sienna, can you just repeat the last thing you said, because you were frozen? I don't know if that was me alone.
I think I heard it.
Okay, you heard. Okay, maybe that's just me then. All right. I know I said we're gonna ask specific questions, but if somebody could if you're willing to give at least like 2 brief points on this question, because I think it's really important and a lot of people may be wondering. So moving over to, school life balance, clinicals and extracurriculars. What's your opinion on them? I know Sienna, you're JAMSA president, and Tahila, you're the representative for osmosis. I know Owen is pretty involved in Sienna as well. So I think y'all would be perfect to answer this question. Do they really count? How long can you actually spend doing it? Because, some activities require a lot of time. And like Owen said, you have to be disciplined and have certain time, set out and stuff. So what would you have to say for anybody who's like, oh my gosh, will I have time to continue my ballet or play my instrument or, whatever it is that you do?
All right, I'll just answer my part real quickly. It becomes very difficult sometimes to balance your personal life with medical school and the extracurricular activities. personally for myself, and observing others as well who participate in different extracurricular activities. I did quite a few things in the preclinical years. I took a step back once the clinical year started, in fourth year especially. I took a step back from many things because I realized it became very challenging for me personally to handle it. So it can be time demanding, and some persons will say you should practice timing yourself or a timetable. That personally has never worked for me, and I don't think it ever will. And that probably means I have poor time management, and that's fine. But it does become pretty challenging sometimes, depending on how much you're taking up and how much you have to do where you are. But it also depends on your mindset, where you are mentally. And please, I know this is not a point that is stressed a lot in medical school. I think it should be stressed more often, is that you have to take care of your mental health. Medical school can be very, very extremely exhausting. And if you're not careful enough, you oftentimes end over the edge, sometimes way below the edge, and sometimes you don't even realize. You have to pay attention to your medical. If you think you need counseling, please go get it. If you think you need to talk to someone, a friend, whoever it is, please ensure that you participate in whatever you need to rehabilitate, because medical school is very draining. Ensuring, maybe, I would agree that time management may be necessary in terms of your co-curricular activities if you do plan to participate in them, to ensure that you have time set aside for studying, as well as your classes online, whether they be online or in person, while ensuring that you still participate in whatever else. I've seen several of my colleagues who participated in debating or dancing, especially dancing. I've realized that they had to take step back sometimes, even though that's the only way they get to express themselves otherwise outside of medical school. They've had to take step back sometimes, and sometimes that is what is necessary for you to ensure that you carry on the flame for medical school, because you can always take it back off. Easier said than done, I know sometimes, because sometimes it's the only outlet you have where your medical health is concerned. But please ensure that if you don't have that outlet, you try to seek one, even if it's in the form of a counselor. And that's my 2 cents on that question.
So just to so just to add to that as well. So personally for me as well, I found that I had a lot of flexibility in pre-clin, but for clinicals, it kind of went downhill because I was more engulfed in school, trying to make sure that I was still on the ball and all that stuff. So the flexibility does go, you lose, you have to. So as Ian said, it really is kind of hard, to be honest, to fully balance everything with everything that's going on. But it might be different for some people, right? And then I also saw something about the gym. I used to go to the gym before I started rotations. And then when I started rotations, I got really tired from classes, walking up and down all day and all that stuff, and the hot days. And so it didn't really work out, but I am trying again. It's really where you have to try to be disciplined, as I've said before, and just try to work something out to have some sort of time management, because time management is always key. But it will be rough in the first part of the rotations, where you're new to the whole rotation itself. So don't beat yourself up and say, oh, you can't manage your time and whatever. It takes time to get used to the whole process itself. So yeah. All right.
So I'd like to contribute to that question as well. I think what I'm about to say may not be something that many people would advise, but I was very involved in a lot of things in preclinical times. But when I got to third year, I realized a lot of my extracurricular activities were not related to medicine. So that was like a wake-up call for me, because I had to think about what I wanted in the future. So I took about half of third year, the majority of third year, just to acclimatize myself, to figure out what exactly it entails and how I need to change my study method. And I think that was the thing that was most difficult for me, because in pre-clin, how I learned is that I would watch videos, I would, read the textbook, and I would continuously write lots of notes. But in clinicals, you don't necessarily have all the time to make the most notes in the world. So certain rotations I would have made notes for, things like medicine. It's absolutely impossible to make notes for everything. So feel it out a bit and then consider your extracurricular. So what I would say is now is the time to get involved in things. I always tell people the opportunities that you get now with regards to extracurriculars, because you're in university, are not the opportunities that you will get after you graduate, when you're in the working world. People offer us things now because they say that we're students and we're developing ourselves. So we get a lot more opportunities to be involved in things than people who are already in the working world. Also, I think it's important to analyze your goals, not just your short-term goals, passing your exams, passing MBBS, but what do you want to do after you pass MBBS? Do you intend to stay in Jamaica? Do you intend to migrate? And that's why it was a big wake-up call for me in third year, because if you want to study in the US, research is a big part of that. Medical-related extracurricular activities is a big part of that. And whereas other universities abroad would give their students more opportunities for research, we don't really get all of that training for research at our program. So now is the time to take up the opportunities and SCORE, to take up the opportunities in SCORME and SCORA, because these aren't necessarily the opportunities that you would get after you've graduated. So set your goals and kind of align that with your new study schedule. Now I do a lot more than I did in pre-clin, and at first it was a bit overwhelming, but personally I like to be very organized, so I use Google Calendars to schedule my time down to the second. I also use Trello boards, so I have something called a backlog, all of the things that I need to do that's school related, that's osmosis related, personal life, and then I can see, okay, things I've already started, things I need to brainstorm, things I've already completed, and I put that into different columns. So that way I can track everything that I need to do. But I would say that being involved in extracurricular at this time is a sacrifice, because clinicals is very heavy, it's very demanding. So something is going to have to give. Sometimes you're not always going to have the time to go to the parties and go to the lives with your friends because you took time and you gave it to an extracurricular and you took that away from your study time. So it's a sacrifice. Sometimes you need to sit out of certain things, or sometimes you need to compromise. So personally, I just like to spend time in coffee shops, but I also have a demanding amount of work for school. So I sit in a coffee shop and I study. So if you can find ways to compromise with time and still enjoy what, makes you you, and the things that, that makes you happy, still find a way to engage in that, but it's just a balance of time. So yeah. That's my contribution.
Thank you for that, Tahila. I see Sion's hand is up.
Right, I know time is going. To answer, firstly, I'll say Tahila's, everything she just said, I endorse it entirely. Perfect way of saying what she needed to say just now. To answer Alexia's question in the group chat specifically, I must say to you guys, as much as you've heard about reading around your patients on the ward, you have to ensure at the same time that there's a topic list. I saw a question somewhere based on the questions that were proposed to us. There is a topic list that is actually proposed for each specialty: surgery, gen medicine, as well as pediatrics. There's a topic list. So while you need to read around your patients to understand questions and answer questions, you also have to ensure that you cover your topic list. And please do not be afraid to ensure that you read your topic list over the patient, because if that's what it comes down to, then you still need to pass your exam. But unfortunately, as Tahila just said, it's compromises and sacrifices, a balance of both to get through not just third year, but fourth year and final year. Okay.
Yes, Sienna.
Yes, I wanted to add to what Tahila said, because if anybody knows me, this is something I'm very passionate about, right? I think I feel very strongly about being able to find balance between schoolwork and things that you're passionate about and care about. And the key thing that she mentioned was that it was medically related, like it's related to medicine, it's related to healthcare. Now, I do a lot of things, right? And I've had to sacrifice a lot. But when I think about it in hindsight, all of what I'm doing plus med school, all of it comes together to contribute to what I'll be doing in the future. I am not wasting time. Like, I'm not wasting time when I'm giving time to my JAMSA work. I'm not wasting time, right? It is something meaningful to me, and it is something that contributes to my development, not just as a future professional, but as a person, right? So a big thing is, I really want to encourage everybody. I know our curriculum is set up in a way where it's stifling and it kind of keeps us in a box where we're very limited in what we have access to and what opportunities we're able to take advantage of. But I say, you just have to work around it, right? Because at the end of the day, I think you're a more well-rounded individual and doctor when you graduate with all these things, having done all these things, having contributed to society on the community level, right? In any way you see fit. And it's also a chance to figure out what you want to do with your life. And you're not going to figure that out by just going to medical school, right? You have to be able to, you have to want to dabble in different areas and see, oh, am I interested in sexual and reproductive health? Am I interested in global health? Am I interested in health policy? You know, all these things. I want to just give a quick scenario. So I started my whole clinical experience on junior surgery, right? I am very interested in global health policy, global health overall, right? It's something I care about dearly. It's always been like a goal of mine to attend the World Health Assembly, right? Which is like the largest decision-making body when it comes to global health and health policy and all these things, right? I waited 2 years to apply for it. And it came to the point where the perfect timing would have been it would have happened between during the break between third year and fourth year. Obviously, COVID had other plans, right? So it turned out that it would happen during my junior surgery rotation. Now I had to find a way to attend because I got accepted and there was no way I was going to give up the opportunity, right? So I spoke with coordinators and everything, and I was able to work it out in a way. Granted, I sacrificed a lot of sleep because the session would start 1 a.m. Jamaica time and 9 a.m. Jamaica time. I'd have to be at the hospital at that time, be at school up until 2 or so, and then come home and study, get some sleep, wake up back for 1 a.m. and do it all over again for 2 weeks. I did that for 2 weeks, right? And honestly, it was a lot, but I don't regret anything because of how much I gained from the experience, right? So you have to be willing to make sacrifice, right? This is at the end of the day, you don't want to graduate from med school and be like, okay, what next? You have no idea where you're going, what to do, how to go about it, where you want to, like, you have no clue, right? So a big thing is making the sacrifices and participating and, just doing things that you enjoy and love, but also combining those with medicine.
Right. So we get to hear it from everyone. It's really just a case that, guys, if you really, really want to still be enough, you have to find the balance into it. You have to be willing to make the sacrifice and you have to find the time. So speaking of time, Tahida, I think you're the best person to ask because you had a balance of both online and in-person's rotation. So how does this whole concept of duty work for clinical students? How late do you normally get home? Are there arrangements for like sleeping at the hospital? And I know you're not commuting, but if there's arrangement for transport for people at home. And while doing duty work, is the case where in rotations, are all the questions standardized or will you be asked questions on cases that you may not have been exposed to? So I can repeat it if you want me to.
Just to clarify on the question, on the standardized question, you're talking about the final exam or just questions you're asked on the board?
For final exam. So will you be tested on cases that you have not been exposed to at all?
Okay.
And the first part was, how does duty work for clinical students? Are there arrangements for sleeping in the hospital or are you just transported?
Okay, so when I started...
Tahila, before you respond, I don't know, for anybody who doesn't know what duty-wear is, if you could explain that, because I definitely don't know what it means.
What duty is?
Yeah, no, yes, please.
Okay, so basically the time that they expect us to be in the hospital for is usually from 8 or 9 to 4 or 5 in the evening. Some rotations may ask you to come in earlier. So I know when I had orthopedics in 4th year, most of the time I would be at the hospital from 7 a.m. So for medicine and surgery, depending on the team that you're assigned to, they're going to let you know the expectations, what time ward rounds are going to start. And then as you kind of feel it out, you'll see, you know, what is expected of you for the day. So currently I am on senior medicine. Ward rounds is at 10, but then I have to see patients and I have classes. So sometimes I go past 5 in the evening. So duty is basically the time you spend at the hospital after 5 p.m. Basically the doctors, they work from 8 to 5, 9 to 5, but there needs to be someone at the hospital during the nights to take care of the patients that come into A&E. There needs to be someone at the hospital 24 hours. So basically duty is working after you've worked from 8 to 5, you stay through the night, do the night shift, and then there's something called post-call or post-duty rounds, which is used usually around 6 o'clock or 6:30. And the consultant and the residents and everyone who's assigned to duty for that night, they review all of the cases, all of the patients that came in overnight. Now, some rotations pre-COVID and before my time would expect you to stay the entire night. They call it a graveyard shift. So you stay the entire night and then you have school the next day. But personally, my experience was that duty was from 5 p.m. to 10 p.m. So you come into school like normal, 8 o'clock, school and your ward duties finish at 5 p.m. Then you join the team that's on duty, which isn't the team that you see in the morning. It's just a team of random doctors assigned to A&E and duty that night. And in my time, we stayed from 5 p.m. to 10 p.m. When we got to, as Sienna said, it depends on the site. But when we get to A&E, you find the patient, they're divided into cubicles. I think it's 1 to 7, and there's a side A and a side B. You ask for the intake list. Do we have any new patients? And it's usually written in a book. And then you can see the patient's demographics. You basically see name, age, and their presenting complaints or their diagnosis. From there, you choose a patient, you click a patient. And if you can do more than one, you click, you do your history, you do your examinations, and you find, you know, your list of differentials and possibly a plan. And then for post-duty rounds, which is usually 6 o'clock or 6:30 the next morning, you present it to the consultant who's in charge of duty. Now, there is no accommodation with regards to sleeping for students. I don't think you all will be expected to do a graveyard shift the entire night. Usually it will end at 10 p.m. There's also no transportation for students. Now, things are very different now because of COVID. We have a curfew. So they may not give you duty at all. Currently, I don't have duty for senior medicine. You may not have to do duty because of the curfew, and they're not offering you transportation at all. But that's basically what duty is. Is that clear? Would anybody like me to go over that before I move on to the final exam? Trevon, you're muted. I can't hear you.
That's me embarrassing myself. Sorry. So just to clarify before we get into the second part, is the case where it's assigned duty or it's optional to do duty? That's only clarification. Someone.
If I am remembering correctly, because for 4th year it was very different. For 4th year, we got to volunteer and say, okay, I want to do this Saturday. Oh, that's another thing. Duty can be on a Saturday or a Sunday. So your weekends aren't necessarily yours if you're assigned that. For 4th year, we were able to volunteer. You were supposed to do 1 weekend duty and 1 duty during the week. So we were able to volunteer for which Saturday we wanted and which day during the week we wanted. For 3rd year, it was very different. They assigned us, but if you missed that duty, you can go to a random duty at any time and just get it signed off because you were there. Once you served your 2 or 3 duties, you were safe. But as I said, it can be very different for you guys because of the curfew and because of COVID. Right now, not all students are allowed in A&E. For emergency medicine, I was allowed, and then there was a spike in cases, and then fourth-year students were no longer allowed in A&E. So, as I said at the start of this, prepare to be fluid. It can get very stressful because things may be changing every week, every rotation. You might be facing something new, and you may not be able to seek advice from someone because they never experienced what you're experiencing. So just prepare to be fluid. It may not be the experience that I had. Regarding final exams, and this was something that I put in the chat because this was something that was very difficult for me to adjust to. So I'm just going to use surgery as an example. For surgery, first I was assigned to cardiothoracic surgery. And then for the second 4 weeks, because remember I told you it's 8 weeks. For how it was for me, it was 8 weeks, they split it in half, and you spend 1 block on specialty, 1 block on general medicine or general surgery. So first I was on cardiothoracic, and then I went to general. But when I was on cardio, they expected us to know everything about cardio and everything about the patients that were there. And after those 4 weeks passed and I got to general surgery, I realized that I knew everything about chest tubes and I knew everything about cardiopathology and management and treatment, but I didn't know about urology. I didn't know about neuro. But my friends also realized the same thing. They had a lopsided knowledge because they weren't specialty. So it's very important to remember that your exam is not going to be based on the specialty you are assigned to. Your exam is always going to be a general medicine exam, general pediatrics, general surgery. So you have to remember, even though you want to shine on ward rounds and you want to be able to answer everything when you're assigned to a specialty, your exam is going to be general. So in my case, there were barely any cardiothoracic questions on the general paper. So I had to work with what I learned in those last 4 weeks. So make sure that your knowledge is well-rounded, that you don't just spend all your time on that specialty that you're on. Read everything. Look for the topic list. There are topic lists that exist. Make sure that you have a general knowledge because you're not going to be tested specifically on where you are assigned. Any questions? Anyone needs me to clarify anything?
Well, I'm not seeing any questions in the chat. Sian, is that our own hand, or is that you want to add something onto it quickly?
Sorry, Sion. Before you go, we're wrapping up basically.
Right.
So for those who are still here, hold on to your seats. We're gonna wrap up after this basically. So thank you, Sion.
Okay. And don't worry, guys, I'm sending the clips into the chat. So there might be some questions that we couldn't get through, and we may already have some information already on our social media pages. So if you guys check the chat, I'm going to be sending some quick snippets of things that we may have seen questions for, but we may already have some Instagram graphics out there, some Instagram information for you guys. So check out the links in the chat so you can watch the videos on your own time, and please follow the pages. So I'm going to close off as we're wrapping up, and I'm just going to allow everyone to quickly.
After Sion, not let Sion has.
Oh, Sion, you had a hand raised.
Yeah.
Sorry.
No, right.
I'm
so sorry. It was left. It was left there.
Oh, it was an own hand for real. Okay, don't worry. So what we're going to do now is we're just going to have a quick wrap up because everyone has made such wonderful contributions, and it's a lot for everyone taking. So I'm just going to give like half a minute to 45 seconds, guys. And I'm going to just go and just say what is one important thing that you wish to leave with students as it is to transition into clinicals with everybody. So around 45 seconds. I'm going to start with Sion since we already have you on. What is one important thing you want to leave with us as we transition into clinicals?
All right, so there, I definitely say be yourself, be confident, speak up when you need to. But most of all, don't be afraid to be yourself a little bit. When I'm saying be unprofessional, no, please, I did not say that. I'm saying don't be afraid to be yourself and be your best self at that because that's your happiest self. And with that, you should be able to maneuver your way through medical school. Not much more than that to say. And all the best entirely to everyone.
All right. Thank you again, Sion. Owen, what is something that you want to leave with us as it is to transitioning into medical school?
The main thing I have to say is just practice. That's really, you need to practice. have good rapport with patients. Yeah, just practice and be confident when questions are asked. Try to answer. That's how you really cement the information. And yeah, so good luck to everyone when that time gets there.
All right. Sienna, what is something you think we should note before we go into clinicals?
I just want to encourage everybody to take it one day at a time. It's going to be quite the transition. And you have to be kind to yourself. You will not know everything. It's going to be uncomfortable. It's going to be overwhelming. You might fail sometimes, but I just want you to try and find that balance and remember why you opted to do medicine in the first place. And you are more than your med school grades. You are more than you are more than doing well and getting A's. You're more than that. So always keep in mind your mental health. Have a support system. Have people rallying behind you, and yeah. So I want to wish everybody the best. All of our journeys will be different, but everybody's gonna come out just fine at the other end of things.
All right, and I'm going to close with you, Tahila. It's the same question basically. What do you think is one important thing or one important message you want to leave with students?
Sure, I think it's important to approach this process with humility. And I think that's an issue a lot of people have. Starting clinicals thinking that you know everything, especially if you've done really well in preclinicals, approach it with humility. You don't know everything, and you're going to realize that you can learn a lot from everyone at every level of the team, from the consultant, your residents, your SHOs, your interns, even the nurses and the porters. Sometimes you're going to learn things that you've never heard of before. You're going to learn new abbreviations that's not necessarily taught in the program, but it's just something you learn along the way. So be open to criticism and be brave. Ask people for help if you need help. Ask for explanations when you need it, but be humble.
Thank you so very much, guys. Before we go, I'd just like to hand over to Samara. We'd like to give, a thank you to everyone who came out and to our panelists as well. So Samara, are you here?
Yes, I am. I just want to say a big thank you to everyone for that. And I'm sure our third-year students found all this information very insightful. Because, I've gone through this last year and it's just surreal. All right, so thank you, guys. I must say thank you to our panelists for taking the time to impart your wisdom, your personal experience. Not everybody can do that. We really appreciate this. Also, I want to say thank you to our co-host. Thank you guys for assisting me today. Trevor, you came on, even though it was later on in the program, but I'm so grateful that you came. Also, I must say a big thank you to the SCOME team. Thank you guys so much. Rachel, you continue to do a wonderful job. And for those who assisted, Geraldine, Kelsey, Shani, for working alongside the Burnout and Wellness team, thank you so much. This session could not be a success without you guys. I am truly grateful. A special thank you to our PRO team. Listen, I don't know what we would do without you guys, and I don't want to find out. And most importantly, thank you, students, for coming. If you didn't come, this wouldn't be possible. So thank you so much, everyone. Have a wonderful night.